We're a family of 5. There's myself, and my husband Jerry, and then we've got Patrick, who's 24, our George, who's 21 on Tuesday, and our youngest is Rosa, who's coming up for 16 in December. She has a condition called Rett syndrome, and we totally are blown away by how she takes it all in a stride and all the medical things that are happening to her. She's just, although I say so myself, she is fantastic. We still want to enjoy our life as a family and have fun. And she makes it so much more easier to look at things that way because she's, I can't say it anymore, she's just fantastic. Part of my responsibility as Rosa's carer is communicating with all the people who are involved with supporting her. So that's in terms of school, short breaks, hospital, everything really. You'd always come across families who don't know about a particular service, and then you can pass on that information to them. And also they might not know about what grants they're entitled to. And that's the way, when Rose was young, going to a group at the Child Development Centre, that I found out there was something I could be applying for in terms of grants. And you just feel more relaxed sometimes in the company of other parent carers or mums or dads because they get it. And if ever I'm a bit down or having to have something done at the dentist, which I'm like, I just think, for goodness sake, get with it. Look what Rosa goes through on a weekly basis sometimes. And then I go to an adult ballet class once a week. I do voluntary work. I'm with Age UK, I'm a befriender. And then there are times when you get together with other families, and it's just, that really helps as well. There are daily updates with Rosa, be it a medication change, be it a treatment that she's had. So within school settings, short break settings, those people will need to know that. There could be a bigger type seizure that she's had. It could be a number of things. And that's the way I organise myself. Sometimes I even photo my lists on my tablet in case I lose them. And that's just the way that works for me, really. And things are usually better if people are working as a team and there is that communication going. But on the other hand, people are understanding. You know, if you say, look, I'm tired, I might have forgotten something, I can phone them back or email them that information. And that's how it tends to work, really. Rosa absolutely loves school life. She loves her class, her teacher, and her friends at school. And because there is the nursing team based within the school, she's able to stay healthy and fully enjoy her school life and learn. And also within the school, they have the physio, the OT, they have hydrotherapy, they have rebound, which is trampoline therapy, and the podiatrist has clinics. The consultant goes in for clinics, and basically that cuts through a lot of what would be extra appointments out of school time. And with Rosa really enjoying school, she would miss a lot of school. And I would think I would be going into a school in a different setting a lot of the time to support Rosa's health needs. So to me, that is just key and vital. And then we have short breaks. And that is the way Rosa goes to short breaks in York within a family setting. And she's been going for 11 years. And that is a home from home, and they have a dog, and she loves that. And then we have a short break setting that's out of York, but they have the backup of the nursing team who are amazing, and within a short space of time, even with Rosa's complex health needs and, you know, her eating, everything, we're up to speed really quickly. And having these short break services means that we can recharge, and we can either have a weekend where we're like, oh, let's relax, or we plan and we have a day trip, we have time away, and we have time for our older lads. And Rosa enjoys where she is as well. My experience within York is they've really done their best to protect children's services, and things are still in place, but the economy being how it is, everywhere is looking to tweak and cut back. Coming up to adult services, well, what a difference. It's like there's this cliff edge you're working towards, and then it's like You could be told, I'll say it quite bluntly, there is no money. There is no money. And that is how blunt it can be. So where Rosa is at the moment at Orchard Court, which is out of York, that goes into adulthood. And it goes into adulthood beyond 25. So in terms of us being supported, Rosa having a good quality of life and being with her peer group, that's what we're hoping for in the future. But we realise it might not be straightforward. But we do have continuing healthcare now. And that is already going towards Orchard Court. And because it's sometimes quite difficult to be awarded that as a child, we're hoping she will have that in adulthood. So there is a pot that could go towards her care for transition. In the social care context at the moment, it's the social worker who's fantastic, yay. And then in terms of health, it's fantastic as well because I can call the diabetes team, the epilepsy team, and the community nursing team, and they're within the same office within the hospital. Rosa has open access towards 17 and 18, and we also have a few consultants involved. That will change. Sometimes in health, 16 is seen as an adult age, so already within dentist, she's being seen as an adult. But for Rosa, her age doesn't meet her needs. As an adult, her GP will be her named person who doesn't really know her because we've always dealt with the hospital. But fortunately, there's a disability liaison nurse within the hospital setting called Jo, and I'm sort of thinking she might be our named person because she already has information on the computer that will flag up Rosa as an adult that people can see, and she will be aware that Rosa has an admission or she's coming in for treatment and things like that. On the social care, I think you get an adult management care social worker, but all I can say, it's something we've thought long and hard about, and we've been preparing for it for years because it is something that is so good now, and we just realise it's going to change, but we're trying to keep ahead of the curve. When you get professionals who are like getting you and listening, that goes such a long way. Otherwise, you're like pulling yourself up again and like, who have I got to phone, and then who does that person need to be in? It just makes it so much more straightforward and less frustrating, and that's the same in social and hospital services. It's been fantastic having the diabetes team, the epilepsy team, the nurses, because I know who I can contact, and they're great because sometimes they will follow things up on my behalf and I don't even know, and then they'll email me or phone me and I'll say, well, thank you, that's brilliant. So what we've got now, I'm holding on to and trying to take it forwards with us, sort of thing. Rosa has a nursing care plan, and which is something that she has in a file alongside a one-page profile. So the nursing care plan sort of condenses the complexities of her health into a few pages, and it's there for people to look at. And the one-page profile is more the social care side of things. It has a photo of Rosa, and it's about her, what she enjoys, what she likes, cheeky, and it's just Rosa rather than her being like a diagnosis, shall we say. And then she has an educational and healthcare plan, which is reviewed annually, and that is looking at everything. So that's looking at how health is going in school, it's looking at social short breaks, just everything. And it's good in a way because we can have the diabetes key worker nurse there, the school nurse, although it's very difficult obviously to get a consultant to come along to these meetings, but they send a report. What I would say about that is that works for us, but with some families it's not that straightforward to get the input from health. And so a message I'd like to get across is communication is key. And since Rosa's been young, it's not always been there, but it's something that can't be complacent about. All the services need to be working, slogging away at it, because bringing things together more makes it so much more straightforward. Sometimes I was never quite sure, well, who could I speak to about this area? I'm just not sure about in health in particular. Health Watch they're just fantastic, because they're really good, they're very positive about what's in place, but they're also there to work on the things that aren't so positive. And as a parent, I've been able to get involved with that, and it's just fantastic, because whereas I've been thinking, oh, I'd really like to see things getting better in that sense, I feel I can just be a little part of that. But yeah, I can't praise them enough. And I think that's where I've seen sort of people who may be more managerial level sort of thinking, oh yeah, let's speak with these families and see what's good with them, and what could they improve, or what's going to make it a bit more straightforward at the end of the day. If you don't mind, I'd like to start off by being very frank. And families are always going to respond better if their young person or child is not seen as a burden or a drain on resources, because unfortunately that's how things come across sometimes. If a need is there, please support it. Keep in communication with that family. There may be delays. It could be more than one hospital involved. There could be changes in medicines. There could be a different kind of treatment after an operation. The GP might be involved in prescribing things that they've not prescribed before, and that might be an expense. And it's all these things, but I keep saying it, but I can't sort of underline it enough. Communication with families and between the services is a real biggie. I think the thing is I look at it as teamwork. We know our kids, but professionals have that knowledge to back us up. And also keep the child or the young person as the main focus, especially when things aren't going well, because at the end of the day, they're at the centre of this. And it doesn't matter what else is crumbling around, you know, if people aren't getting on or there's been a mistake, it can be brought back to the child or the patient, and they're the main focus, and to keep that central to everything. I think it would be absolutely brilliant if services keep on working together and being creative and using common sense when money's tight to come up with solutions, and not necessarily thinking we've no money, what we're going to do, because there are solutions. Another thing is, please cut out the jargon, and where you can, cut out the paperwork, because staff are so tied up with paperwork, it takes them away from the job they want to be doing. Can I just add, because I think it's very important, that you keep celebrating the wonderful people you've got working within your services, because it's not always great for them, and we as families, we do appreciate the roles they have, and they're very supportive. And also, if they could just remember that if family is a bit tired or angry, their circumstances are probably just making them be at that point, and that's not necessarily who that family is. But we think you're pretty wonderful. Thank you.